Cervical cancer starts in the cells of the cervix. The cervix is the narrow, lower part of the uterus. It connects the uterus to the vagina. The cervix makes mucus. During sex, mucus helps sperm move from the vagina through the cervix into the uterus. Before cervical cancer develops, the cells of the cervix start to change and become abnormal. Growths on the cervix can be benign or malignant. These abnormal cells are precancerous, meaning that they are not cancer. Precancerous changes to the cervix are called dysplasia of the cervix, or cervical dysplasia. It is a common precancerous change that can develop into cancer over time, if it's not treated. It's important to know that most women with dysplasia do not develop cancer. Cervical cancer is almost always caused by a human papillomavirus infection. The human papillomavirus is a group of viruses that cause skin or genital warts. Infection with HPV is caused by direct contact, and in the case of the cervix is usually aroused by sexual contact or even by skin-to-skin contact. Risk factors for cervical cancer include the onset of sexual intercourse at an early age, long-term use of hormonal contraceptives, multiple pregnancies, poor hygiene, other sexually transmitted genital infections, like herpes virus, having HIV. The most common signs and symptoms of cervical cancer include abnormal bleeding from the vagina, bleeding between regular menstrual periods, bleeding after sexual intercourse, heavier menstrual bleeding than before, bleeding after menopause, pain during sexual intercourse, more vaginal discharge than normal. Once a definite diagnosis of cancer has been made, the cancer is given a stage and a grade. A grade is given based on how the cancer cells look. To find out the grade of a tumor, the biopsy sample is examined under a microscope. There are 3 grades for cervical cancer. Grade 1, low grade, slow growing, less likely to spread. Grade 2, moderate grade. Grade 3, high grade, tend to grow quickly, more likely to spread. Treatment for cervical cancer include surgery. Surgery is an option for women with stage 1 or 2 cervical cancer. A decision to have surgery depends on the size and location of the tumor. During the operation, all or part of the tumor, and some healthy tissue around the tumor are removed. Radiation therapy. The radiation damages the cells, normal cells as well as cancer cells. Radiation therapy may make the vagina narrower. Radiation may also cause early menopause. For some stages of cervical cancer, the preferred treatment is radiation and chemotherapy given together. Options for chemotherapy include cisplatin is given weekly during radiation. This drug is given intravenously, about 4 hours before the radiation appointment. Cisplatin plus 5-fluorouracil is given every 4 weeks during radiation. The chemo drugs most often used to treat advanced cervical cancer include cisplatin, carboplatin, paclitaxel, topotecan, gemcitabine. Complementary therapies for cervical cancer include massage therapy, which is used together with conventional cancer treatments. Get the HPV vaccine. It protects against the types of viruses that most often cause cervical, vaginal, and vulvar cancers.